Now it's time to hear from our sponsor. I would like to welcome to the stage Peter Menziuso, President of the North American Division of Johnson & Johnson Vision Care. He is also the co-chair of the Healthcare Alliance for Patient Safety.
Thank you very much.
Thank you.
Thank you today for the opportunity to present on behalf of Johnson & Johnson Vision, as well as the Healthcare Alliance for Patient Safety. The speakers today are already driving some very thought-provoking thoughts in the space of telemedicine, and I'm looking forward to the upcoming panel post my discussion. What I can tell you already is it's very important that we're having this conversation. There are places that we're absolutely aligned on the benefits of telemedicine, but there's also conversations that we have to have in this space where there's differences, and we'll talk more about that in the course of today. The one thing that we must agree is, for years, we've been talking about telehealth and telemedicine coming into the space of healthcare. It's here already. We talked earlier, you heard some of the panelists talk about behavioral health for patients in rural cities that are taking counselors through conversations in behavioral health. School nurses are using telemedicine to help access routine care for illnesses in children, and they're saving parents from the need to go to their pediatrician or even going to urgent care. People that are living with tuberculosis are uploading videos, and they're sending their daily medication routine to their physicians to demonstrate compliance. For all of us that are gathered here today, we know that telehealth has remarkable potential. It can empower people who otherwise would be unable to access health care. It can enable people with both chronic illnesses or terminal illnesses to check in with their providers without ever having to leave their homes. Telemedicine also can cut back on unnecessary trips to the emergency room, and they can allow providers to quickly diagnose who really needs more comprehensive in-person care. But of course, like any technology, all technologies, especially telehealth, must be used in a very prudent way. Telemedicine can absolutely increase the ability for access to healthcare. It can lower healthcare costs, and in some cases, it can even improve outcomes. But we must be sure that the patient's health is never compromised in the name of convenience or cost savings. So today, I'm really fortunate to be representing two esteemed organizations. First, Johnson & Johnson Vision Care, where I serve as president for North America. And since our introduction of the AccuView brand contact lenses and the world's first soft disposable contact lens in 1987, we have passionately been pursuing new technologies that are meeting the highest standards of care and also driving unmet needs for patients. We haven't stopped since that introduction. Over the last 30 years, we have consistently been on the forefront of eye health technology, most recently with our evolution into broader eye health. We're looking at solutions that can help a patient along their lifetime of journey of needs in the space of eye health. But we know that the advancements are not possible without keeping two core principles in our organization and our innovation agenda. Patient eye health and safety are a must. Now, the Healthcare Alliance for Patient Safety, of which Johnson & Johnson is a founding member, also holds the same principles to be true. I'm pleased to be here to present remarks as a co-chair of the Alliance. The Alliance is a leading voice for patient health and safety. It's comprised of health advocates, innovators, trusted health experts, all in the eye health community. And there are 5 key principles that are guiding the Alliance. The first is the preservation of the doctor-patient relationship. The second is making sure that as we prioritize health and safety of patients, we also look how healthcare technology can advance in that space. Third, we want to ensure that when a doctor is writing a prescription for a patient, that prescription is written as honored. Fourth, it's ensuring that today's regulatory framework promotes patient health and safety, and that it's also enforced. And fifth, we want to be a source for policymakers, for the general public, with information that is useful to protect patients from any type of unnecessary harm. These are the key principles that the Alliance has considered, and it's also the principles that we think about when we talk about the role of telemedicine in the space of eye health. And yes, with this potential, we're already seeing some challenges when it comes to telemedicine in the space of eye health. In some instances, convenience is at the expense of patient well-being. Some online sites are not requiring an updated or valid prescription to renew contact lenses. Others are encouraging patients to skip a comprehensive eye exam. As an eye health company, we know that eyesight is the patient's most valued sense, and it's critical to keep our eyes healthy. We must also experience the world in a way that requires us to stay very close to the healthcare of eyes. Eye health is also essential for primary care. Over 250 systemic diseases and illnesses and conditions can be detected through a comprehensive eye exam. For instance, diabetes, heart disease, thyroid conditions. And while today's telehealth technologies can help connect more people to care, they do not completely replace all of the elements of a comprehensive eye exam. We're excited to see where these technologies will evolve and advance in eye health. And as we continue down the path of technological innovation, the Alliance is working to ensure that the doctor-patient relationship stays at the center of care. As we see this as a key component to ensuring that patients are receiving the highest level of care, that they're taking advantage of telehealth as it meets and fits in their needs. Not everybody sees it this way. There are some states that have proposed to remove the provider out of the eye health equation, and in this process, potentially putting patients' eye health and safety at risk. That's why, as telehealth initiatives advance, we must ensure that patients receive the same high standard of care as they would as if they were in their doctor's office. At the end of the day, we recognize the world is transforming faster than we could ever imagine. Medical professionals are consistently looking at new technologies to provide better care for their patients. From x-rays to vaccines, once what was thought was novel is now routine. In this respect, telehealth is not different at all. That's why it's so important that we are having these conversations today. As we think about telehealth and its potential to improve patient outcomes and access, we must make sure that these solutions are keeping the doctor-patient relationship at the center of care. Thank you very much.